Good afternoon, everyone. Thank you so much for joining us at today's webinar. Bit of background, today's session is a part of National Patient Data Day, which is an annual initiative led by Use My Data that brings people together to talk openly about health data, how it's used and why it matters. Anna, if you don't mind, I actually cannot see the waiting room when I'm presenting. Would you be able to admit people from the lobby?
On
If you have the
it.
Thank you so much. I knew I could rely on you. Okay, so today's session is jointly organised by Understanding Patient Data, Use My Data, Connected by Data, PEDRI and HDR-UK, so there's a lot of us here today, to contribute to that wider conversation about patient data. It's part of an umbrella programme of events that is celebrating and recognising National Patient Data Day. National Patient Data Day is an opportunity to raise awareness, to build understanding, and to encourage dialogue between the public, patients, and those working across the health data system. And importantly, it creates a space to explore how we can use data in ways that are trusted, transparent, and deliver real-world benefit for people and communities. An initiative everyone involved with today's session is excited to be supporting with today's webinar. Now, some very brief housekeeping for you to be aware of. Today's session is being recorded, and that is to make it accessible after today for those who are not able to join us. And there will also be a Q&A at the end of today's session for you to pose questions to the panel, and you can use the Q&A function on the toolbar for Teams to be able to pose your questions and upvote the questions you want to see asked, so we can get to the popular ones as we work through that process. There are also captions available if anyone should need them, which you can toggle on through the settings in Teams to control. Just as a bit of a brief pause here as well, because I think language is important to talk about. And throughout today's session, you might hear the use of the term public partnerships used. And I appreciate many on today's call might be more used or familiar to hearing PPIE or patient and public involvement and engagement. There's a bit of a shift within some systems to starting to use and adopt the term public partnerships, which is a move that personally excites me very much. I think it's great. The NIHR defines this as a term that collectively describes the ways in which patients, service users, carers, and members of the public work with researchers and health and care professionals in the creation and use of health and care research, which fully encompasses the components of involvement, engagement, and participation. Now, this definition from the NIHR obviously focuses only on research, but I do think that this is a term that really better celebrates and acknowledges the variety and the nuanced ways in which we form and maintain relationships with the public to inform, influence, and improve the work that we do, which I think is particularly relevant in the health data space operating across research and policy fields. Sometimes PPIE can feel a bit technical and institutional, whereas public partnerships can be a bit clearer and more accessible language, especially people who are new to kind of operating and working in this space, and hopefully something that resonates with people and better reflects the wide range of ways in which members of the public can shape and contribute to work. Plus, it can't be confused with payment protection insurance, which I do think is a nice bonus if you were to ask me. You may hear both public partnerships, PPIE, public involvement and engagement used interchangeably throughout today's session, but I just wanted to clarify because I appreciate for some people that might be new terminology and understanding where that fits in the scope of the language that we use when we talk about how we work and engage with members of the public. Now, just a bit of background to set the scene before I hand over to people smarter than I. We're coming together for this session at a time of rapid change in the health and care system, data use and research landscape. So from across, AI uses in healthcare to national data initiatives, the opportunities to improve health outcomes through the use of health data are significant and are being leveraged across all spaces. And the success of these rapid changes and the setup of large-scale programs is really underpinned by meaningful and embedded public partnerships. People want to understand how their data is used, to have a say in decisions, and to see clear benefit and safeguards. The meaningful involvement of public voices in these systems creates better trust, better decision-making, and higher advocacy from the communities who will ultimately benefit from them. But it is also a challenging time for good quality and influential public involvement and engagement, with structural shifts across the system and significant funding changes affecting this landscape of public partnerships. There are concerns being raised from public and practitioners alike. So we feel it's therefore an important time for us to consider the value of partnership, collaboration, and shared learning across this complicated and multifaceted landscape that can really help to ensure public voices continue to be heard and create change. And there are many organisations working across the system doing really valuable work to build capacity, to promote collaboration and amplify public voices in decision making around health data. Some of those organisations, many of them, are represented on the panel and the webinar today, and you'll hear from all of them in a little bit. But there are many other actors across charities, policy and research working in this space to create a positive influence. But from both a public and sometimes a practitioner perspective, isn't always clear who's doing what, how we work collaboratively across the system to tackle these shared system-wide challenges, which brings us on to today's session. With that in mind, today we're going to focus on how organisations are embedding public insight into real-world work and the practical approaches to strengthening trust and transparency in decisions around health data. Who's doing what and how are they doing it well? We'll also explore how we can build capacity together across the system to work better together, including what effective collaboration looks like in practice and how we can create a more joined up approach to engagement. I hope you'll agree that this is going to be a really interesting session and there's going to be lots of time for discussion and questions in the Q&A. But to kick us off, I want to introduce you to the person who will be leading us through these discussions and conversations today. To guide us through today's session, I'm delighted to be introducing you to our facilitator, Samina Begum. Now, Samina brings extensive experience as a public contributor with a background in the mental health sector and a strong track record of involvement in health data research. She's a member of the Use My Data Executive Board and works closely with researchers and organisations to ensure that public perspectives are meaningfully represented in decisions about data. Now, Samina will share a little bit more about her experience shortly, but for now, please join me in welcoming Samina to facilitate today's discussion. Samina, over to you.
Thank you, Charlie, for that introduction. Afternoon, everyone. I'm Samina, and I'm from West Yorkshire, in a small town called Bradford. And I've been part of Use My Data since 2022. And really, the focus of that is really to making sure that the patients and the families and carers' voice is included in data research and governance. I've also been part of Cancer Research UK's project, and that looked at health data inequalities and how data exaggerates the inequalities that we have in different communities. Hi. I've also been part of the Bennett Institute's Open Safely platform and sit on their platform committee, but also other data access committees, where I've helped review the research proposals. And also looking at contributing to AI systems standards and guidelines. I don't know, is there an echo coming? I can hear Charlie.
I think there was a couple of people with microphones on who I've just muted. So I think you should be okay.
And finally, I've been a community researcher and working with local communities in research, but now looking to widen that to think about how can we involve communities in data research, and facilitated a couple of workshops around data privacy, the usability of the NHS app, and also AI in healthcare. Right, so thank you for that. Okay, so before we begin, I'll just briefly outline how the session will run today. We're going to start with a series of short lightning talks from each of our panellists here, giving a snapshot of their work and how they can approach public engagement in health data. We're then going to move on to a facilitated discussion across two themes. The first being strengthening public partnerships, and also then the second one being collaboration across the system. There will also be time for audience question and answer sessions, and you can use the Teams webinar question action function throughout to submit your questions, and then you can also decide who you want to upvote others or who you'd like to from the panel to respond to. Thank you. So my first speaker is going to be introduction of Chris Carrigan, data advisor to Use My Data. The UK's only independent movement of patient relatives and carers focused on how patient data is used to save lives and improve outcomes. Chris works at the heart of an organisation that brings patient voices directly into conversations about health data, advocating for a future where every patient can confidently choose to share their data for their own care and to support research. The Use My Data community represents people from all walks of life, and they're united by a shared belief in using data responsibly to help others and improve outcomes for everyone. So thank you. I'd like to welcome Chris. Over to you, Chris.
Thanks, Samina, and thank you, Charlie, for doing all the organisation behind this. It's much appreciated. I thought you summarised where we are really well, Charlie, at the start, saying there's a huge amount of patient involvement in research and data, more so in the past few years than I'd ever seen. And that also means there are more organisations like us in this space. So I think it's really good that we've set this up to bring us all together. From a Use My Data perspective, as Samina said, we're quite different. We are a patient movement. We're entirely independent, and the people who fund us have always let us set our own agenda. It's been completely hands off. So we are led entirely by patients through a small executive group. And I essentially am part of the secretariat, and I do what they tell me to do, which includes coming here talking at things like this. Our members come from all walks of life and all parts of the UK. And they all have different views. We were accused at one stage of having one simple view: use my data, that's it, get on with it. But actually, when you speak to people, there are lots of different nuances of views amongst our members, as we see amongst the public as well. But all our members are really bound together by the belief that our patient data needs to be used to save lives and improve outcomes for everybody. And what we'd really like is every patient in the UK willingly giving their data to support medical research and their own care. But we know we're not there yet. So as an organisation, we want to be that trusted voice for patients and the public in discussions and decisions about the use of our data for research and for improving healthcare. So we bring patient voices to discussions about patient data. We are patients, and we bring our members' voices to those discussions. And really importantly, we support them as an organisation to play more active roles in those discussions. One of the things that we do with our members is one thing I'm involved heavily with, is to provide continued education about all things data. Data is messy and complex, so we provide education sessions once every 3 weeks or so on a particular data topic to help them understand more and play more active roles, more informed roles in all that they do. As a movement, we've always advocated for transparency about the use of our data, and several years ago, a good example of collaboration, we worked with Understanding Patient Data to develop a set of transparency principles which were written by patients. Those have formed the basis of the principles which are widely used across healthcare now. It was a really good example because in this case, the Use My Data members, the patients, relatives and carers, drafted these, but Understanding Patient Data brought their skills in terms of getting these principles out, getting them in practice, and advocating them and pushing them at a policy level. And we couldn't have done that alone. I think it's a really good example in the early days of how collaboration really works. It wouldn't have happened otherwise. A similar example was the way that our members developed this thing called a patient data citation, which simply reads, this work uses data provided by patients and collected by the NHS as part of their care and support. A simple phrase we would like all researchers, academics, others to use. Whenever data has been used, stick it on the bottom. And we wrote that, we produced that, but it only really became effective when we worked with Understanding Patient Data and Health Data Research UK, because they were the ones who had the links into policy and into the decision-making processes to make it happen. They had the influence to get it to work. And now we've seen that citation has been used thousands of times across the whole academic and commercial communities about how they're using patient data. Now, that would never happen without that collaboration. And the last one, I was going to give you an example. We launched National Patient Data Day, which Charlie described very well, 24th of June. And the launch event in Leeds last year was requested, designed and delivered by our members, by patients, relatives and carers. But it would absolutely not have had the impact it did without support of several organisations, including sponsorship, but mainly support, where there's a joint recognition that this was the right thing to do, a right thing on which to collaborate, and it was hugely effective. So those are a few examples of how I think collaborations work and where we've worked. Just to sum up what our key aims, we really promote the responsible and accountable use of patient data. And we really want to remove some of the barriers which we don't think are fair that are blocking some of the research we'd like to take place. We also want to make sure we keep transparency about everything that happens with our data if you want to find out. And we focusing on highlighting the benefits of use of patient data rather than what people normally hear, which is around the risk and negativity side. And one thing which we do as an organisation, which again is quite different, which has grown significantly, which continues to be in high demand, is our role as a critical friend to organisations who collect or store or use patient data. More and more of these groups, academic groups, policy groups, commercial groups, and other organisations are coming to us with a sort of a question that they want to explore with a group of our members, with real live patients, relatives, and carers. Now, these are often tricky or contentious or even ambitious thoughts about how data might be better used. And we can bring those patient voices, informed patient voices, directly into those conversations at the earliest of stages. So to sum up, as Samina said, we are patients, relatives, and carers all working to ensure patient data is used to create and support an NHS that is better for all of us. We think we play an essential role in the world of patient advocacy, but I think we become most effective when we can collaborate with other organisations, as I've explained. And I think that's, again, echoing Charlie, that's why this session for me is really important, so that we can all explain what our roles are as organisations and bring those things to the wider audience to say, how do you think this fits? Are there some challenges you want to put to us, as well as challenges we want to put to ourselves? So thank you. Thank you, Samina.
Thank you, Chris, for that. Okay, I'll bring our next speaker in, who is Anna Steer, Head of Understanding Patient Data. Anna leads the organisation's strategic direction and oversees its work to improve how people understand and engage with the use of health data. She brings over 20 years experience across communications, engagement and research, including senior roles at the Department of Health and Social Care and NHS England. Over the past 8 years, she has played a key role in shaping major data and technology initiatives, and that includes the Data Saves Lives strategy, the National Data Opt-out, Shared Care Records, Secure Data Environments, the NHS AI Lab, and the Federated Data Platform. Anna is passionate about ensuring health and care data is used safely, securely, transparently to improve outcomes and save lives. Please join me in welcoming Anna. Over to you, Anna. Thank you.
Hi, thank you. I feel honoured to have that introduction. So hi everybody. Hopefully you can see my screen. I can no longer see you, so if there's any questions, let me know. So we aspire to be the UK's trusted independent voice on patient data. That's not to undermine others on the call who would see themselves similarly. We all work together very much in that space, as Chris says, but we are really all about sort of making the use of patient data more visible, more understandable, more trustworthy, with a really sort of non-neutral but sort of balanced aim to ensure it can be used well, responsibly, and for public benefit. There's currently 5 of us, nearly 5 of us. We've sort of oscillated around the 3 mark, I would say, for most of the last year or so, but currently a full team of 5. Obviously you've met Charlie. Shbila's also on the call, who's our new research and evidence manager, and we also have Lucy, who leads on policy and comms, and then Chinchi as well, who supports the whole team. We, as an organisation, were set up actually sort of from within the Wellcome Trust about 10 years ago to support conversations around this topic, following on from the National Data Guardian's review of data security, consent and opt-outs, which obviously came off the back of care.data. If anybody might remember that, it was a kind of quite controversial programme. But we were set up obviously as an answer to that, I guess, to fill some of the void in the sort of lack of information and clarity in this space. And we are currently funded by Wellcome, NIHR, NHS England, Department of Health, OLS, and the Medical Research Council. So we're really lucky that we have at least another 4 years of funding to do what we do. This is our theory of change, which I know is a little busy, but essentially what we're trying to explain is that we know that use of patient data really depends on public support and confidence. and that is a kind of correlation of, you know, awareness and understanding of both sort of benefits, risks, as well as you know, support in principle. And so if we go about making these patient data more visible, understandable, and so on through our, you know, research and evidence synthesis, through our influence and advocacy, and by supporting that kind of capacity building in the system, then we can ensure that decision makers really understand, you know, what the public expectations are around use of their data. We can ensure that the public voice is visibly and meaningfully included in the debate, and we can sort of build those kind of skills and sort of capacity in the system as well to sort of deliver it. Really obviously hoping that people are at the centre of the decisions around the data, and that their support and confidence is built and maintained over time. And I'm kind of purposefully avoiding the word trust, because I think it's kind of a proxy for lots of things, and I think it really is that correlation between awareness, support, and confidence. So just to go into a bit more detail about what we actually do, because it's quite different from what Chris does. In fact, we rely heavily on Use My Data to give us access to, you know, an educated forum of patients. We, you know, obviously we ask Use My Data a lot to help us get access to the right people, and we benefit enormously from the education sessions and the newsletter, which I think is fantastic. And you know, we really don't quite operate in the same space, but we are hugely complementary. So we primarily conduct an enormous amount of research to understand public views, and that can be on a specific topic or it can be with a particular community. But the idea is that we can understand people's expectations, requirements, concerns at scale, and sort of bring those things into sort of live policy and communications debates. So we do a range of things from, you know, polling to sort of deep quantitative, qualitative research, co-production, and it's, you know, it kind of comes together as kind of one holistic evidence base that kind of can highlight, I think, sometimes those gaps between like assumptions and reality, but we also, I think, have a real emphasis on sort of inclusivity, and we often work with underserved voices to ensure that, you know, they also feature in the debate. We then sort of use that influence, that research and evidence to sort of leverage and do the influence and advocacy piece, and make sure that policy is actively shaped by that evidence base, and we'll do that by sitting on, you know, any number of advisory groups, and by engaging with the media, and by bringing people together to sort of get a consensus view on sort of controversial topics. And we really try and encourage sort of balance and sort of, you know, fact-based reporting and responses to things that are sort of, you know, playing out through that sort of communications lens. And then finally, we're also very well known for creating reusable resources that sort of support the system to communicate outwardly. So quite sort of an intermediary role rather than sort of a direct to public role, that will provide materials that then others can openly use, that help to translate some complex issues into accessible formats. We always do that in a co-productive way, so it's very much based on, you know, how people want information presented and tested with people to ensure it lands. And we're also at the moment building a lot of the kind of hopefully helpful infrastructure that the sector might need. So things like, for example, our health data compass, which is in the middle of this slide, which is going to be a sort of live interactive evidence hub around public attitudes, so people can go in and find out, well, you know, what questions have already been asked, do I need to ask it again, who else is operating in this space, can I go talk to them? We also on this page just sort of have a few examples of other things. This is a recent briefing. We work with you know, National Voices and the MRC and others, as well as those on this call, you know, to kind of brief around really important issues like the health bill, which contains legislation to support the creation of a single patient record. We're currently doing a deep piece of research with asylum seekers to ensure that their voices are kind of heard. It's a very pertinent topic. They must, you know, many of them must be feeling quite worried seeing what's going on in America at the moment. And yeah, as I say, we, you know, some recent resources that we have developed have been on data security, but we have a whole range on our website, which will be brand new and sparkly by September, and hopefully things will be easier to find. So yeah, I think that's a high level summary, and I'll stop sharing.
Okay, thank you, Anna, for giving that overview, and I can vouch that I've used some of your resources as well, especially when doing community engagement. Highly recommended. Thank you. So our next speaker is Doreen Tembo, who was the head of public involvement and engagement at Health Data Research UK and strategic lead for the Public Engagement and Data Research Initiative, or PEDRI. Doreen brings extensive experience across national and global health research, having held leadership roles within National Institute for Health and Care Research and worked with universities including Oxford, Cambridge and Southampton. She began her career in Zambia, where she developed a strong commitment to meaningful public involvement in health research, policy and practice. And she continues to champion approaches that put public partners at the centre of data and research initiatives, helping organisations build stronger, more inclusive engagement practices. Please welcome Doreen. Thank you.
Thank you, Samina. So I'm wearing two hats today. The first is as the head of public involvement and engagement at Health Data Research UK. And the second is as the strategic lead for a partnership organization. So I will try to stick to my 5 minutes, although accepting I'm doing two organizations, so that's going to be a bit challenging. So to start with, I just wanted to highlight what HDR-UK is about. So HDR-UK is furthering the linkage and use of data so that can positively affect both public health and also applied health within the clinical setting and to further innovation as well. And underpinning this, we recognize the importance of making sure that we're working in a trustworthy way and that we're bringing the public along with us in our mission. So for our mission as the public and patient involvement team, public partnerships as we're calling it today, is to establish good practice and to really improve research, making sure that throughout research and innovation we have transparency, that we are acting in a way that furthers public trust and confidence, both within our organization but externally as well. And our vision is that all health data research should deliver benefits to diverse people, research and innovation, as well as the fact that it should listen to the needs and concerns of patients and carers, and this should be enabled by shared decision-making throughout the whole process. In terms of the areas that we focus on, very briefly for HDR-UK, the first is pretty much internal, looking at making sure that we are having the public and patients as decision makers alongside our other stakeholders, so that as much as we can, we're collaborating, we're co-producing with them. The second is that we're listening to the needs and interests of the wider public, and not just listening, but that then affects how we work and the feedback that we then provide into the sector. For the third one, it's around trust and transparency, making sure that we're working in a way, as I said, where we are building trust, confidence around the use, but also the reuse of data for research and innovation, and that this is being done in a way that works for diverse communities. And then finally, the area I'd like to focus on today is partnerships. So we don't want to duplicate the brilliant work that's being done. We want to bring people together. We recognize that we can do so much as a whole rather than working in silo. So I wanted to highlight one of the partnerships that we host within HDR-UK. And this is an organization that I think many of you on this call, because I recognize quite a number of names, have heard of, which is PEDRI. So this is the Public Engagement and Data Research Initiative. And the vision and mission here for PEDRI is that we'd like to see a world where everyone has a role in data for research and statistics, and that they help to shape decisions that actually deliver meaningful benefits throughout society, and that this can be enabled through trust, transparency, and collaboration amongst different organizations. And the mission here is for PEDRI to bring communities together, to share learning, to really effect collective action so that we can transform how we engage with data and statistics together. And our mission is to foster a culture in which organizations really embrace the public voice across all relevant aspects of their work, working in a way that's responsible, ethical, and impactful as well. So PEDRI was founded by a number of organizations. I won't go into their meaning, but happy to elaborate. So they came together because they recognized that really, although they looked after different data areas. Often, if something happened in one of the sectors that really endangered, that caused distrust, in the whole system basically suffered. A lot of people are also doing similar things. So these organizations came together so that we can join up our work around involvement and engagement. It started with about 4-5 organizations, and now we have 20 leading organizations across the data-driven research ecosystem, and you can see some of their logos there. And we work across all types of data. And PEDRI itself is a neutral convening organizations, bringing people together. And it's really aiming towards national delivery and enabling consistent high quality public involvement and engagement. In terms of what we do, I won't go through the exact projects that we're doing because of time. But like I said, it's really collaborations and partnerships and convening. And I think the key thing that we're known for is our good practice standards around public involvement. We went through a very long process of consulting with the sector to define what good looks like within the data and statistics ecosystem. And then another part of our work is enabling engagement, but making sure that this engagement is involved, that it's two-way. And then we also have a learning and development work stream where we're developing learning resources, but also a database where people can search for what has been done so that they can learn. And we're also in the processes of creating almost a dating site for communities that are engaged with data, want to work with researchers so that researchers can link up with those communities. So through all of this, we're trying to effect a culture, a positive culture within public involvement and engagement in data and statistics. And we want to make sure that we do this in a way that recognizes equality, diversity, and inclusion. So that actually runs through all of our work. I will just finish by highlighting what our standards are, because I think they frame the discussion in this webinar really well. So as I said, equality, diversity, and inclusion is really key. Within this field and the complexities that public members are dealing with data and statistics, data literacy and training is really important. Then that two-way communication, being really transparent in how we work with the public is crucial. Making sure that how we work with the public is mutually beneficial to both sides is really crucial. And then also the fact that we want to avoid tokenism, which is so easy to do in this field, because to be honest, it can be quite difficult to see how we can work with the public in different ways for some of the projects that we support. So it has to be effective or meaningful and must have a purpose. And then finally, we work to change how organizations work. So we want organizations to really work with the public in a meaningful way. And under this, I'll just highlight the work that one of our public partners led, which is, she said, this is all great, makes a lot of sense for your researchers, but what does it mean for the public? So she actually led a project that transferred these these standards basically into a pledge, so that if an organization took these standards and said we're going to adhere to them, they actually pledged to also make sure that the public could see that difference through the pledge work. So I will stop there.
I think, Charlie, you had your hand up. Oh, you were okay. Congratulations. Thank you. Thank you, Doreen, for that. And I've somebody who's already been in the past involved with PEDRI standards as a public contributor, so it all sort of resonates to me. Thank you. Our final speaker is Jenny Tennyson, founder and executive director of Connected by Data. Jenny is a leading expert in data and AI with experience spanning technology, governance, strategy, and public policy. Through Connected by Data, she works to ensure communities have a meaningful voice in how data is used and governed. She has held a number of influential roles, including CEO of the Open Data Institute, and currently chairs the UK Government Digital Services Responsible AI Advisory Panel. Jenny is also a senior fellow at the Centre for International Governance, Innovation, and an adjunct professor at the University of Southampton. With a long-standing commitment to open data and public participation, she brings a powerful systems perspective on how we can reshape decision-making around data please join me in welcoming Jenny. Over to you, Jenny. Thank you.
Thanks so much, Samina, and also particularly to Charlie for organising us all to be here as well. Yeah, so as Samina said, I set up Connected by Data as a campaign for communities to have a powerful say over data and AI, recognising that that's the way that we get good uses of data and AI. We are a very small team, 3 part-time people. We're philanthropically funded. We're in our last year of operation, actually going to be wrapping up in March 27. Our work is focused on advocacy and practice around engaging and involving the public around data and AI across sectors. So we don't just focus on health, and we don't just focus on research. We focus on uses of bringing public voice into the development of things like actual systems and services on the ground, or into policy making. So have that very wide scope. And for example, we've been doing a lot of work recently, specifically in education and the introduction of AI tutoring tools. So we see across the kind of system and across sectors. The kind of work that we do in part touches on public attitudes, but we don't do very much kind of research ourselves. We have done a little bit about that. In particular, I'd point to a piece of work that we did a couple of years ago called Health Data Stories, where we really tried to dig into some of the fears and concerns that people have and why they have them around the use of health data. But we mostly focus on building capacity within public bodies and also within civil society to have good conversations about the use of data. So, for example, we do quite a lot of advising on, sometimes doing evaluations of public participation activities, such as citizens' juries or assemblies, and that's again cross-sector. We've also, over the past couple of years, been running a community of practice for public participation practitioners in the public sector in the UK, and have been organising an international participatory AI research and practice symposium where we gather people together around the world to discuss different kinds of approaches and intervention points around bringing public voice into shaping particular AI there. We also do a bunch of our own kind of conferences, unconferences, and other kinds of activities. But I think one of the places that we also may be distinctive is that we have a strong interest in and advocate around collective power when it comes to data. So not just going directly to the public and involving them in decision making, but also really recognizing the role of civil society and grassroots groups, organized civil society. So, you know, Use My Data is a really nice example of that, where you have people coming together to create a collective voice that can also be a real assistance and route for public sector organizations who are trying to work out how to use data well. We had a project a couple of years ago where we were really focused on those grassroots groups that are trying to affect change around data. One of them, Maternity Engagement Action in Birmingham. I worked together with fairly closely to amplify the work that they'd been doing around perinatal care for Black mothers. We also have a focus on the impact of data and AI at work and the role of workers to shape technology adoption. So we've been doing that around teachers and education, but also trying to work with organizations like Health Workers for a Free Palestine, for example, or MedAct, other kind of places where we can recognize that worker voice is also important in shaping good uses of data, AI, other technology. And as part of our work around civil society, we've also catalysed a data and AI civil society network that helps across sectors, again, to enable civil society organisations that are working in this space to help work together. That isn't specifically focused on public engagement, but as I say, we think that collective voice is also important in this space. Thanks very much.
Thank you, Jenny. Okay, so we're going to move on to the into the panel discussion, and we're going to explore two key themes. So the first theme is about strengthening public partnerships, and at the heart of today's conversation is a simple idea that decisions about health data work best when they're shared with people and not just for them. So in this part of the discussion, we're going to explore what it really looks like to embed public voices into projects and decision making that's in a meaningful way. We'll hear about practical approaches that organisations are using, how they build trust, and how they communicate about data in ways that genuinely connect with people. So we're going to move on to the first theme, which is about the importance and relevance of public partnerships within health data. And my first question is going to go to Anna. So why is it important for public voices to be meaningfully embedded in decisions about health data? And how does understanding patient data create the space for that partnership? Thank you.
Thank you. Well, I think health data is deeply personal, and I think decisions about how it's used can bring enormous public benefit, but I think it also raises really important questions about privacy and control and fairness and accountability, and I think that people should have a genuine opportunity to influence those decisions. Trust isn't something that organizations demand, it's something they have to earn, and I think meaningful public partnership is one of the ways that happens. And I think, we have to be really honest about the consequences of, particularly, certain communities being disengaged and, opting out of the data use. People's choices actually, really need to be respected. But I think if certain groups are less represented in data, then they're less visible in research and they don't benefit from, innovation either. And that means that the sort of benefits of research are not equally shared, and there's poorer outcomes, for those as well who sort of have that lower level of trust. So UPD's role is really to help ensure that sort of policy and practice reflects a really broad range of public expectations and needs about health data, and that the trade-offs and the risks are appropriately and timely spoke to. So we don't just talk about benefits all the time without acknowledging the risks. And we do that in several ways. We obviously have our kind of macro level research, but we also run sort of community projects that explore a range of perspectives from underrepresented groups. So we've done Black and Asian communities, Gypsy Roma travellers. We're currently, as I said, doing refugees and asylum seekers, and we sort of then support like the sector-wide conversations about how public involvement in health data can be strengthened, and try and sort of achieve sort of change in policy and practice off the back of it. But I know that everybody on this panel has the same aim, I think, but we all deliver that aim in quite, I think, diverse and complementary ways, either by sort of supporting the PPIE community itself through best practice standards, or by directly convening and engaging the public, as Use My Data do, or bringing everyone together across sectors where we can learn so much from each other, as I have benefited from through Connected by Data. So there's just so much going on, and I think the main thing for us is that we're also reflecting on our own practice as an organisation and asking ourselves how we can bring even more public voice into the kind of way that we operate, not just in the way that we sort of communicate outwardly. So I don't know if I roundabout answered that.
Thank you, Anna. Next question for Chris. Use My Data as an independent movement of patients across the UK. From your experience working so closely with patients and public, what do you see as the key things that help build trust in how health data is used?
Yeah, thanks, Samina. I suppose I'll start off by reflecting back on the first question. If you're thinking about involving patients, don't think, but actually go and do it, and do it early. Don't think it's something that patients wouldn't understand or wouldn't be interested. Some certainly will be, but you do need to invest your time and energy in them as a researcher, as a charity, and whatever. The things that we found in the past, and we've all seen this, is I think a little knowledge can increase worries in people about health data. If they see something out of context about health data, they become a bit more worried rather than more trustful. So you have to invest time and energy into a constant drip feed, if you like, in telling people what's happening with health data. And that's where many of our organisations fit, I think. One thing we've said, which I've said earlier on, is transparency. So transparency is absolutely critical in building trust. By transparency, I mean telling everything that's going on, good and bad. Transparency is about telling bad news as well as telling good news. If you only get half the picture, that actually damages trust, not productive. So it's critical. You know, if somebody's interested enough in try and find out how their health data is used or it's held, it's really important they can find out. Maybe I should challenge each one of you to go away this afternoon and try and find out where your health data is and what happens to it. It's really tough, even when you've worked in this space. So we've got a long way to go with transparency in terms of helping people understand the realities of what health data is and what it means, not least with things like the single patient record coming up. I think it's fair that many people won't care. You care a bit more when you turn from being a member of the public to being a patient, because it's a bit more pertinent then, but many people sort of don't care. You have to recognize that. But we do need proper transparency, particularly for those that do. And maybe when patients flag where it's difficult to find something out about data, there should be a process to be able to address that. And we don't really have that yet. There's no real mechanisms for somebody to say, I've tried to find this out, but I couldn't, or don't understand this. Could we explain? Now, it's something individually as organizations we do some of, but I don't think we've nailed that down yet. Because if one person is struggling to understand something, there are bound to be others in exactly the same position. Because as I said, where I think where people don't see that clarity or can't get a clear answer, it's human nature to feel that something's been hidden from you. And that feeling being hidden really does damage trust, doesn't help. The last thing I was going to point out was that if you think about what people see about patient data, health data, it's largely negative. They read the media, that's where they consume this information, and it's largely negative. So from a use by data perspective, we really try and focus on the positives, positive engagement, and the benefits of using patient data, which is what National Patient Data Day is all about. But those messages can be really difficult to get out there as a small organisation.
Thank you, Chris. Handing over to Doreen now. So PEDRI is working to improve public engagement practice in data and statistics. What practical approaches do you see for involving people meaningfully, and how is PEDRI helping organisations to put those things into practice?
Yeah, I actually quite like the preface that Charlie gave at the beginning of this webinar around public partnerships, and the fact that there's a lot of definitions for sometimes the same thing, but sometimes the same word is used to mean different things as well. So I think it's actually really useful perhaps not to focus so much on terminologies, but actually to look at the spectrum of how you can work with the public. So I think public partnerships is a great term because it's just the different ways you can work with the public. And I think for public engagement, involvement to be meaningful, you need to look at the spectrum of the different ways that you can work with the public. And sometimes it will be consultation. Sometimes it's going to be slightly more involved processes. In other ways, it could actually be completely user-led or public-led, move towards kind of the democratic end of the spectrum. And I think sometimes there's a danger because there's proponents of one particular approach. But I think for it to be meaningful, you have to look at what the task is at hand, and working within the world of research. There's so many different research approaches. So what will work for one project is not going to work for the other. So I think looking at what makes sense in that particular aspect, what kind of public partnership approach could you use is really important. So we work along the whole spectrum. It can range from kind of communication that perhaps isn't even two-way, but you're communicating, as we've learned, I think, from the responses of fellow panelists. Communicating in an effective way is really important in this field, in that trust building space. But there are also some of us that work in that very engaged, involved way, where people are involved in a democratic way in decision making as well, and governance. So it will vary what kind of approach you use. And I think there's a danger of sticking to a certain approach. A lot of people have told me, for example, that, everything should be co-produced. That's the gold standard. But that might actually not fit the purpose of what you're trying to do in certain circumstances. So I think relevance and avoiding tokenism to box tick to say that you've involved the public or worked with the public is really key. And we work with a very diverse range of stakeholders, from those that are doing almost discovery research to data science that has more applied kind of translatable aspects to it. So it will vary. I also think that sometimes on the flip side, there is a danger that people see their research and think it's really technical and they can't work with people because it's really technical. But there's lots of examples, especially some of the work that NIHR is leading, and ONS as well, where we have seen demonstration of people actually being involved in studies that are related to modeling and statistics in the actual analysis phase, which a lot of researchers will miss because they just intrinsically think that's not a place to involve the public. So it really does require thinking what makes sense for this project, but where can I push the boundaries and not being complacent and thinking that this isn't an area I can involve the public in. So I would say that for it to be meaningful, it has to be effective, it has to make sense, it has to be mutually beneficial as well, and not be extractive is a really key point. So how we work with partners at PEDRI is we sit down with them, we find out what they would like to do, what they have in place, what's the purpose of their work, and we then try to help partners to devise strategy in the case of organizations. Or if it's a research project, we help them to work through the research cycle and what they want to do to see where it is actually effective and meaningful to involve the public. And then we link them up with the necessary public as well.
Okay, thank you, Doreen. This one's a question for you, Jenny. Connected by Data talks openly about changing how we talk about data. What would you challenge about how we currently communicate about data, and what should we be working towards? Thank you.
Thanks. Yeah. So this is a really tricky one, because I think that we very naturally fall into a way of communicating about data that is all about ownership. And I actually think that that's quite problematic for how data is actually used. So health data is either talked about in terms of like, it's my data that I have ownership over, or sometimes at the policy level that it's a national asset that the kind of society owns, right? And both of those really rankle for me. When we have data that is about us, actually sharing and using that data, or not sharing and using that data, doesn't just affect us, it affects our families, it affects people that are like us. And I think that in a society, we do have some obligation to think about how other people are affected by our own sharing of data. The other complication is that in health, for example, there's a lot of data that is embedded in doctors' notes, for example. And if you think about that being used for training AI systems, surely doctors should have some kind of say, or they have some interest in that as well. But on the other hand, I don't believe that it's just something that can be decided by the government or by particular organizations, because what's acceptable is often like really nuanced, really context sensitive, and all of those different interests really need to have a voice in shaping what that looks like. So when it comes to communication personally, then I really try to avoid those kinds of implications of possession. I talk about who has interest in data, who data is about, who creates data, and then who it impacts. And I think for me, focusing on who gets impacted by data usage and them having a say over what data gets shared and not shared is in many ways more important than where the data comes from. And those for me are the kind of communities that we should be most kind of engaging with and making sure are involved in decision making. But yeah, recognizing that range of interests and recognizing that it's not just about kind of possession, I think is really important for us getting to a good place that balances those interests, particularly around the use of health data, but other data as well.
Okay, thank you, Jenny. Just a reminder to people on the call, if you want to put your questions, you can add them to the chat, and then we'll have a session there that we can address them. Okay, thank you. So we're going to move on to the second theme now, and this is all about collaboration across the system. We know that no single organisation can tackle all the challenges around health data on their own. And real progress, it happens when people and organisations work together, they share what they've learned and they join up their efforts. So in this part of the discussion, we're going to explore both the opportunities and the challenges of genuine collaboration, and hopefully hear examples of where joint working has made a difference and how sharing that learning excuse me, can help us move faster and have a bigger impact. So I'm going to come to Jenny first of all. Connected by Data works across many parts of the data landscape. From your perspective, what does a truly collaborative ecosystem look like? And why is collaboration so important for improving how we involve the public in decisions about data? Thank you.
Thanks, Amina. I'm going to try and be quick because I know I want to make sure that we do have some time for questions. So I guess for me, then there are three kind of areas where I think collaboration is really needed. First of all, around public bodies who are actually and other organisations who are actually trying to engage with the public and with civil society, they need to learn from each other about how that works best. And sometimes they need to team up with each other to enable bigger and better kind of engagement with communities. So some of our work around building a community of practice, having conferences, bringing people together to talk about best practices is part of that. And, you know, PEDRI's work there is really essential as well. The flip side is that I think civil society also needs to have some of that collaboration as well. So we need civil society to be diverse and to reach different parts of the system in different ways. We've already seen the kind of ways in which Use My Data and UPD interact in order to be more effective. You know, often civil society organizations are small and mighty and they focus on very specific areas and topics, and they need to act in solidarity with each other in order to get the kind of impact and heft that they need to have. And that's why, like, we do stuff around bringing those together through the Data and AI Civil Society Network. As well as in smaller and more focused coalitions around particular topics. But then the third thing is actually bringing together public bodies and organizations that are using data and civil society to work together. You know, public bodies and others who are using data really need to reach the public through civil society groups. Those are real useful conduit, but the public and the people who are members of those groups really trust the decision making of those groups. So there's an ability to confer trust on what organizations are doing through those groups. Civil society are also the organizations that can detect early when things are going wrong, because they listen to the people who are actually on the ground and experiencing it. And I think that getting those relationships between civil society and public bodies and others using data is really, really essential for learning how to do things better, particularly when technology is moving fast as it is around data and AI. So yeah, those three areas of real collaboration, just in order to get public voice better used with the organizations that are using data, sharing best practice, organizations that are really representing the interests of the public and can advocate for them, working in coalitions in collaboration, and then getting those links between them working, I think is really essential, and often where there's some challenges. Anyway, I'll stop so that we can have more time.
Thank you, Jenny. I'm going to come to Chris now. Patients often experience the system as fragmented. So from your members' point of view, where could better collaboration between organisations which make the biggest difference to clarity and confidence around data use?
Yeah, thanks, Samina. So I'll pick up on that word fragmentation and describe a couple of areas where patients, our members, see fragmentation, and then what we could collectively think about doing about it. The first is your own health record. Your own health data is all over the place in lots of different places. And we've heard initiatives such as the summary, the single patient record in England is about addressing that. But getting patient voices into early thinking is really hard. I think that's better if we can do that as a collaborative challenge. I think the other area around fragmentation is around lack of clarity on things like national policy. So certainly our members get confused, a bit annoyed when we hear about things like implementation, integration, and they see lots of repetition, lots of duplication going on. And I think what we could collectively do is try and understand those things better, hear what our members, for instance, saying concerns them that they'd like more clarity on, and collectively begin to work on those solutions. So I don't think that's any of us that could singly adopt. The other thing around fragmentation is we know that if you're going to understand how we collectively want to improve the system, you need to understand more about the system. By the system, I mean NHS, academia, use of data generally. And that really enforces the need for me to invest more time and energy into our patients and the public to explain all this. And each of us has said elements of that already. All that is best done in collaboration. And one last thing I would flag, Jenny mentioned that her team is 3 part-time people doing all this work. It's exactly the same size as Use My Data. We've got 3 part-time people in the secretariat, plus supporting 500 or so members. So all this is being on quite a small scale. And I think collectively we could think about how we need to beef that up as well, so we're not all scrabbling around for small amounts of cash. Thanks, Amina.
Okay, thank you, Chris. Over to Anna now. Understanding patient data works across a wide range of organisations, generating and sharing insights about public attitudes. So from that vantage point, what are the biggest challenges to achieving genuine collaboration across the sector, especially when it comes to sharing learning and avoiding siloed approaches? Thank you.
Yeah, I think the biggest challenge is probably capacity, and then I'm speaking particularly to Isabel's comment in the chat, that sort of lack of sort of a central coordinating function. I think that most organisations recognise the importance of public involvement and collaboration, but the time and funding and expertise to do it well is often quite limited, and I think it's often sort of treated as someone's role rather than a core function that's properly resourced. And I think the other challenge is that organisations operate under different incentives and pressures, different timelines and funding requirements and governance structures and strategic priorities. So even if everybody wants to collaborate, I think those practical realities make it really difficult. But the consequences, I think there's a tendency to repeatedly generate new evidence around the same sort of topics rather than to make the most of what already exists. Everyone feels like they need a sort of individual mandate for the same, and we often kind of hear the same messages back, and sometimes it's nice to be reassured that the same thing's still true, but it doesn't add anything. And I think that that sort of confidence in other people's evidence and activity is a kind of a real issue. But I do think that while there isn't sort of one obvious central organisation, or it would be appropriate for one organisation to take over, coordinating function, I think we need to collectively come together and think about how we tackle those sorts of systemic issues. Because I guess collaboration can really vary. Sometimes it's like major cross-sector projects. Sometimes it's serving on other people's advisory groups and sharing evidence openly, or simply like having really regular conversations to learn from each other, which is something that all of the people on this panel are doing, really proactively trying to work together and find places in which we can support each other and really elevate and amplify the work that we are doing that all has collective impact and value. I think that the most effective collaborations are just relationships and built on trust and the willingness to share. They're not really based on formal partnerships, and I think there's a real appetite across the health data community to do more of that, so it's really positive.
Thank you, Anna. Finally, to Doreen. HDR-UK leads on large multi-partner programmes across the UK. Can you share an example of where collaboration between organisations has really accelerated progress? And what was it that made that joint working successful?
Yeah, I might quickly share a couple of examples. I think one within the trust and transparency space, which I think is really important considering the work that we're all doing, where in terms of, I think, going back to Chris's comments around the importance of being clear about our processes, who's accessing the data, what's it being used for. Public members in our public advisory group board at Health Data Research UK picked up on the fact that a number of organizations that hold data custodians, were not clear about what was happening with their data, who's accessing it, how can they find that information out. So they independently started doing some work auditing the websites of data custodians in the Health Data Research Alliance, which is an organization, a partnership again, a membership organization, I should say, that HDR-UK hosts. And through that, they were able to identify that actually transparency was a real issue in the sector. And then independently, our Pan-UK Data Governance Steering Group also identified that this was an issue. And the two groups came together and then worked on a set of transparency standards and created this basically co-produced set of standards, which was great. But I think we all know that you can produce standards and they often sit on a shelf, virtual shelf, nobody uses them. So what they did, the Alliance actually incentivized those data custodians to take on these standards so that they can make changes on their website, and that led to real change. Some great assets and explainers for members of the public were actually created by some of the recipients of those grants to really explain what was happening with the data. So for me, that's a great example because it shows that a user public-led project joined up with the one that was led by staff and then led to such change in the sector. And then very briefly around community engagement, I just wanted to highlight that HDR-UK has a community engagement program. We wanted to incentivize diverse communities, refugees, young people, people with dementia, et cetera, to really engage with data. We could only fund a small number of projects, but we were overwhelmed by the demand. We had about 500 applications when we're intending to basically fund 10, 15 at the most. And I think the importance of bringing organizations such as what we've done today, which has come together, is you get to know each other. You also trust each other. You find some shared agendas, things that you can do together. We were able to utilize the partnerships that we have, both from the HDR-UK front and the PEDRI front, to actually get more funding, so that we were able to more than double the number of projects that we could fund. And it's been great bringing data to communities that hadn't ever thought about it. And now a lot of them would like to engage to see how they can use data to further some of the causes that they are passionate about and that can really help their community. So I think for me, that was another great example of what you can do collectively together rather than trying to do something as one organization.
Okay, thank you, Doreen. Thank you to all our panel for those questions, the second theme. We're going to go into the open questions and answer session. So you can either pose the questions or you can put them in the chat, or you can even, I suppose, raise your hand if you want to ask the question. There's an opportunity to do that as well.
There are a couple of questions in the Q&A at the minute, Samina. Are you able to see those?
Yes, I'm just getting onto that now. Yeah. Yes, thank you. Yeah, okay. Okay, we have one from Jenny, sorry, Isabel, from Isabel asking about, can you share information about the community of practice, Jenny, that you referenced? How do people get in contact with you to find out about that?
Yeah, unfortunately, we've had to wrap that up because of lack of funding, basically. But there are a number of other kind of community of practice groups that are still running and in existence, and let's share some of the links to those, as Charlie said, after this call.
Okay, thank you, Jenny. Okay, we have one from Charlie. It is not allocated this to anybody, but if anybody from the panel wants to answer, if you could change one thing about how the health sector approaches public partnerships around health data, what would it be and why? Okay, Anna?
I'll give it a go with a heckle from my own team. I think that I'd want to see public involvement moving from a series of one-off engagement exercises and being treated more as an ongoing partnership. I think too often people are either asked for views once decisions are already well underway, or at least in principle, or they're asked early on and then there's kind of no follow-up or feedback loop to kind of say, well, we heard this and we did that, and are you actually happy with where we went with it? There's like an assumed kind of mandate then. So I think it's that kind of that idea that people are kind of involved continuously, that it's a conversation. And the other thing is like the quality of involvement, not simply the quantity, because I think that there's a lot of duplication and uncertainty around like what proportionality looks like in terms of public involvement engagement. You know, like do I need to do a citizens jury on this, or should I just put out some communications? And because of the lack of kind of any clarity around practical application of, you know, what good I guess might look like, I think there's a lot of overcompensation. So one thing we've been exploring doing is something called, we call it the right sized engagement tool, where people can kind of look, you know, ask the question, has this been asked before? What do we know about this? What would be a proportionate you know, a level of public involvement engagement on this topic, and trying to get sort of sector-wide buy-in to something like that so that we could all have confidence together. Yeah, because then I think we can all collectively feel like orientated in what might be expected and appropriate based on what we're doing.
Okay, I'm just going to bring in Chris. Thank you.
Well, firstly, to echo what Anna said, very sensible. There are some topics where we think we probably know what we need to know. Let's get on and do something about it rather than asking people again. I just spotted a question that Isabel, or part of the point that Isabel had put in her long question, which is about ensuring local voices being heard at a national level. And both Jenny and Anna have mentioned these things called citizens' juries. I don't know whether anybody on the in the audience has been on citizens' jury. If not, it's a good thing to be on, either as a witness or as a member of the jury. These things are very well structured. They're designed to answer a particular question. I've seen and heard of juries running for the past probably 5 years now. But what I haven't really ever seen is a collation of what those juries said. Because if we put the time and energy into having a jury running over a weekend with lots of money supporting it, well, maybe in the same way that case law generates precedents, maybe some of the citizens' jury output, which are all designed locally, could begin to generate some national precedent. Or at least let's have them all lined up so we can see what people have said when they made a considered judgment about a particular problem. So that would be one example. You could bring that practical example of local voices into the national framework.
Thank you, Chris. I'm going to bring in Dory now. Thank you.
Yeah, I totally agree with both Anna and Chris. I was thinking, though, that again, looking at that spectrum of involvement, I think it's really important as well to consider creative approaches and communications, because one of the things I would like to see change is the scale at which we, you know, involve, engage. And we focus a lot on tech and what it can do for us on the care and research side, but maybe thinking about what tech can do for the involvement side as well, especially if we're thinking of involving people at population level. And in terms of creativity, a lot of creativity is used to dissuade people from being involved and opting out where they see that as the only vote that they can make, you know, to opt out. So I think we could be much more creative with our comms, both in terms of comms at that media level, but also in the grassroots and how we actively engage people. Going back to the point that I think Chris made, that the average person doesn't actually wake up and think what's happening with my data today. They're not engaged. They've got a lot of other things they're thinking about. So I think for me, I would like us to diversify how we engage and communicate with people.
Okay, thank you. Jenny, to you.
Yeah, I wanted to pick up, I agree with a lot of what's been said there. I think one of the challenges around kind of participatory activities like the big set piece citizens juries and those kinds of things is that we tend to see them as a mechanism for kind of extracting public attitudes, understanding what it is that people think, rather than seeing them as a mechanism for growing trust in the public more generally. And if you see them as a mechanism for growing trust, if that's the goal, if that's part of your goal, not just understanding what the public think, but also engaging properly and reflecting that back, and it being a democratic process that grows legitimacy, then you start thinking about how you communicate better, as Dorian was saying, how you engage with the people who might be most critical throughout that process, so that they see it as legitimate as well. And it gives a different kind of perspective on those kinds of activities. It's not just about research and understanding attitudes, it's about a democratic process that grows trust with the public and legitimacy in action. The other thing I wanted to, that was struck me as people were talking, that I'd like to throw in is like those local conversations are so important, I think, because they can be really nuanced, they can be really context specific, they can be really focused on particular communities and the particular uses of data. And I really agree that pulling out some general lessons from those is very helpful. One thing that we did recently in education was have a set of materials that were then used for deliberations in the classroom across a whole bunch of different settings with 1,000 students being involved overall, and then had the mechanism of bringing back the lessons from that into some more more general lessons that were used in order to inform some policy making at the centre. But the distributed deliberations meant that the teachers themselves got to hear from students about how they wanted to have AI being used in the classroom, and that I think is really important to hear locally by the people that can actually affect change at that local level. But then having the similarity in approach across having a distributed dialogue then means that those general lessons can also be brought out. And so I'd love to see us exploring some of those kinds of mechanisms a bit more as well.
Okay. Thank you, Jane. It's really interesting and reaching out to students and schools. The next question we have is from Speller, who says, thank you for all your insights. I wonder if funding constraints were not an issue, where should we prioritise efforts to most effectively strengthen public partnerships in health data space, and what would make the biggest difference? So if anybody on the panel wants to respond to that. Go ahead, Jenny. Jenny, go ahead.
I saw Chris put his hand up as well, so I hope he'll talk on this. But I think that we need to have really effective, like, public partnership people who are really good at thinking through these things, embedded within every research project, every product and service development project. And I don't think that we've quite got that range of expertise yet. I think that there are some people who know how to do this really, really well, some expert organizations. But if you want to have that really embedded across the system, we need to have practitioners that are skilled up, that are supported, and it needs to be a part of every single activity that is around data and funded like that, right? It needs to, the public engagement part of the activity needs to not just be a side thing that is a checkbox exercise, but something that has skilled people leading it. So I would really focus on building that set of practitioners out, so that and making it a requirement in those kinds of projects.
Thank you. Over to Chris.
Yeah, I think I'd agree with what Jenny said. The one thing we've heard something about recently, and it comes up quite a lot, is the general level of health data literacy that we've invested in our young people. So getting things like health data into the school curriculum would actually be quite a nice thing to do. So people can learn at an early stage the choices they have to make around their lives, around social media, but also around health data as well. That'd be quite a neat thing to have. There are some people who are doing that around different parts of the country, we met another group of them last week. So I think that's, if you're talking about money, no object, I would say let's invest right at the start in young people's education, not least because they'll tell you some stuff you might not have thought about in the first place. So it needs to be that two-way learning process. In terms of practical things, I mentioned the data citation we developed earlier, which we wanted just to appear simply on the bottom of every piece of output that came as a result of using patient data. That's gone out fairly widespread, thousands and thousands of users, but it could be more. And it's a very, very small piece in the ocean to try and build that understanding of this was only possible because you use your patient data. Interestingly, the BBC have now adopted that on their adverts. If you notice, this was only possible because you paid your license fee. Thank you. That's the same as the patient data citation. So drip feeds like this actually can help. But that was a very small scale, very cheap thing to do. It didn't cost us any money.
Okay, thank you. I'm not sure if it was Doreen or Anna next. Apologies.
Doreen.
Doreen,
yeah, I think for me it's a really interesting question and one that's made me really think. There has been massive cuts and dissolution of organizations that have been working within this space. We had the a national coordinating unit, for example, in the NIHR that is no more. Health Watch is being disbanded. So I think we're seeing a trend where in actual fact we're having the opposite, where there's constraints and hence there's a scaling back in the institutions and the organizations that are furthering public partnerships. So I think the first is to look at what the different organizations are doing, and seeing the gaps that has left and seeing how that could be plugged with organizations that we have. I do think that scoping out all the organizations' remit as we are trying to do it within this partnership, seeing where we can have efficiencies from working together, not duplicating each other's work, and working effectively with existing resources actually really important. If we had more money, then it would be great to have more staff. I think a number of us have said just how much we're trying to do with very limited staffing. But I definitely think some more organization, a coordinating function between existing organizations is really key. With my research hat on, the key complaint we get from researchers, which is very valid, is I think it's been said in this webinar as well, that you need to start early to really have meaningful involvement. But if you are starting early before you've been funded, there's always a question of who actually funds that engagement. It's a perennial issue that isn't solved. A number of funders are exploring whether they can provide these funds before granting the main grant, but it's an issue, and I think that would make a lot of difference because it means that researchers would then be working with communities early on, and not doing it on a shoestring budget or being very tokenistic. We've had consultants, go to their waiting room and ask patients questions because there's no funding for them to actually do this correctly in an ethical, responsible way. So I think I probably would focus on these system-wide issues, and then from a researcher point of view, that pre-grant stage is still an unsolved problem.
thank you, Doreen. Anna?
Yeah, I would just agree with obviously everything that everyone said as well, thinking about kind of those incentives to sort of undertake or get involved in public partnerships. I think the thing I'd change would be having more joined up conversation. I think like the infrastructure in terms of engagement on research in particular is quite well established, but obviously it's really, we're increasingly talking about sort of the role of big tech companies and AI and possibility of linking data across sectors and, having a digital ID and so on and so forth. And we're still communicating and engaging on a sort of topic by topic, program by program kind of a way, when actually it's not gonna, stay like that. So for me, yeah, it's about having an increasingly joined up conversation that's sort of acknowledging, the direction of travel and the sort of new ideas and ways of working, whether that, taking account kind of those global geopolitics and shifts, but also the kind of, what happens, I suppose, when data can be more systematically linked and used for wider purposes.
Thank you. I think that's it with the questions, and I know that we've covered Isabel's question as well. The panel responded to that. So we're now going to move on to sort of final reflections, and I'll be, if I give people 1 minute, the panel members, to sort of answer these final 2 questions. So what would you hope that people take away from this session today? And how can collaboration continue beyond the event? So if Jenny wants to answer that first, you're on my screen first.
Sure. So I hope people just take away that there are many other organisations, many other people who are working towards better public engagement, involvement, partnerships, whatever word you want to put around it, both in health data and beyond that, and that there is a lot to kind of learn from in terms of experience there, but also to link up in terms of being able to take action together and move the field forward and activity forward. I've mentioned a couple of things like the Data and AI Civil Society Network, which is still ongoing. And I'll also share around the Connected by Data newsletter in case anybody wants to join up to that, where we share all sorts of these kinds of activities. So yeah, I hope to follow up afterwards with those. Thanks.
Okay, thank you, Jenny. I'll come to Chris. You're next.
Thanks, Sabina. I suppose takeaway, I'm hoping people have learned a bit more about what these organisations are and what we do individually, and indeed where you might challenge us to do things more better collectively. So that's to be the first thing. The other thing I think people want to take home is this is a tough place in which to operate. When we hear about several gazillions of pounds being put into technology, how much of that actually works its way into communications, for instance? It's not a great deal, and I've argued for a while that the biggest challenge we've got in terms of using our data better is not tech, it's not data, it's not wires, it's actually hearts and minds of people, and that comes down to communication. So I think that's a key take-home message. And in terms of where we go from here, National Patient Data Day was meant, as it's already doing, to coordinate lots of different things. It's an umbrella which everybody needs to cover. We've seen that for the first time this year, and it's only our second year. So I would encourage people to think about getting involved for next year and make it even more widespread and shared as a resource.
Okay, thank you, Chris. I'll come to Anna now.
I'm conscious that we've got 1 minute left. I'll just quickly say I'd like people to go away knowing that we're here, that we do talk to each other extensively, that we will increasingly and more visibly, I think, be working together. But obviously, do come and talk to any of us if you would like to. And we obviously welcome your feedback and insight on what you think we could do to support you.
Thank you. And over to Doreen.
I probably will say just what Anna said in view of the time, but it's very much almost word for word what Anna was going to say.
Okay, thank you. Right in the dot, it's 1:30. So I think Charlie will follow up with all the resources and any links that can be shared. And I hope today the session has really been useful for people, but also engaging with some of the questions that we've asked. And hopefully there are other things, as Chris said, National Patient Data Day, events that are still happening online that people can sign up for. And I think Chris will then hopefully give the resources and links to Charlie as well to send those out to people. And thank you. It's my first time facilitating this, so any things that I've said untoward or not done, please apologies, for that. Thank you.
No, can I just very quickly say as we close out, a massive thank you to Samina for facilitating that really brilliantly. It's really lovely to have you at the helm of those discussions, as well as a massive thank you to all of our panelists today and for everyone for joining. It's nice to see a sea of applause there. I hope you're seeing them all, Samina, because you've done a really fantastic job there facilitating those conversations.
Thank you. I've really enjoyed it, and listening to all the other organisations, what you do. Yeah, thank you.
Doreen, did you want to?
And just a massive thank you. I know a number of people have already said to Charlie, who's organised this. There was a bit of herding cats, so congratulations on bringing us together.
Thank you very much. Appreciate it. Well, we'll let you go now. We're 1 minute over. Apologies for that. Enjoy the rest of your afternoon, and we'll be in touch soon with resources and links. And thank you again for your time.